Testing has obviously been key to all of this. Well, lots and lots has happened over the last week. As we now know, ministers say Leicester could become the first place in the UK to face a local lockdown following a so-called spike in infections. We'll dig into that in a second. Public Health England says 866 have tested positive in the city over the last 2 weeks, a quarter of the total cases since the start of the pandemic. Well, someone who's been taking a look at some of this data is Dr. Duncan Robertson from Loughborough University School of Business and Economics. Now, Duncan, you're used to sifting your way through this kind of stuff. What have you been able to glean?
Well, I think it's quite difficult to know what's going on, because if you look at the data that is published every week, and what's been shown at the press conferences, and this is on the coronavirus.data.gov website, it doesn't look as though Leicester is special in any way. And the reason for that is that just looks at one sort of tests, which are the NHS tests. And what we've really seen is these private tests, for example, NHS Taste and Trace, really are showing where the incidence is in Leicester. And for that, you have to look at the Public Health England data, and that's only is published on a weekly data. And it shows that Leicester does have a high incidence, but it's still difficult from the data that is publicly available to know how big it is. And so, as you say, you just need to get these snippets of information that you had a quarter of cases in the last couple of weeks, which is obviously very significant. And I think I have to have a lot of sympathy, actually, with the Mayor and the Director of Public Health in Leicester, because this data has only been available to them just very recently. And these are the people who, should be knowing this data, but it's been kind of centralised and hasn't really been disseminated. So, what happens next is also a very interesting question.
Look, it's very difficult. I suppose I can't quite get my head around why we're here. Then, if you're saying that the data that you've seen, and maybe somebody knows something we don't know, but why therefore would Leicester be being singled out this way?
Well, I think that's is a good question, because if you look at the Public Health England map, there are outbreaks all over the country. So particularly around parts of Manchester and around there. But I think just looking at the information that's available, what seems to be interesting about the Leicester case is that the outbreaks that happen can either be in care homes, hospitals, schools, prisons, and that may be what's happening in other parts of the country. But what seems to be happening in Leicester is this seems to be an outbreak in the community. And that's obviously quite concerning, and that's, I think, why Leicester has been singled out. But I think the other thing to think about is what's going to happen next. And, the actual local authority, Leicester Council, doesn't have a lot of ability to do things. So what happens next is very much down to central government to decide what happens. And, from what has been kind of released this morning, it seems as though the current regulations are going to be continued for a couple of weeks. Now, it's all speculation. I realise meetings are happening at the moment. But of course, that means, for example, pubs might not open in Leicester. And if you think, well, if you're desperate to go out to the pub, what do? You just go to not Leicester, just on the boundary. And of course, that raises the prospect of, potentially it spreading even further. So it's going to be very interesting to see what happens in Leicester. But I think, you've got to think from your own point of view what you can do. And, just social distancing, washing hands, not going and mixing with lots of people. Just think about yourself, but particularly think about, if you have it, what happens to other people who are close to you? So back to these rules: social distancing, washing hands, and just thinking as though you may have it.
Look, which frankly is exactly what we were talking about, you and I, back in the latter half of March, for heaven's sake. But sorry, just to go back to that question about the way that the virus is being transferred to one another. Presumably, therefore, if you can track it down to a specific place, and we know this has happened elsewhere in the country, a meatpacking plant and so on, you can effectively quite tightly lock that down, can't you? But if it's being transferred in the community, that's what the scientists would say is the worry.
Well, exactly, and this goes to what Director of Public Health can do. So if it's happening in a meat processing factory, you just kind of lock the doors and you have the authority to do that. If it's out in the community, it's much more difficult to trace who's actually got the virus. And of course, the NHS Test and Trace is meant to do exactly this. It's meant to enable you to report who you've been in contact with, and for those to be contacted as well, and for those people to isolate. And I think, that hasn't been going terribly well. And I think, looking at the app and all the sort of technological innovations that are meant to have happened, they're not in place yet. So I think what I would say is if people do get called up by NHS Test and Trace, just try and give as much information as you can and to cooperate with them as much as you can, because I think that will help slow it as well.
Duncan, in the meantime, there's lots of number crunching going on. We spoke to Mike Sand from the county just an hour or so ago, less than that, on the programme, and he said, look, we are really chewing through this stuff as quickly as they can. I think the city are a bit ahead of them because they got the information a little sooner, I think, is the way I understand it. Presumably, you and other scientists will be doing the same.
Well, I think we're looking through the data that is available, and I think what's has only been recently released is this data from what's called Pillar 2, which is the public tests. And the data quality around there isn't that good. So it's very difficult to know exactly where these outbreaks are taking place, and things like, ethnicity of people, where they work, and, to try and track it back to individual locations. So I think, people outside Public Health England are going to find it quite difficult to know what's going on. So, all we have is statistics produced every week about where particular hotspots are. But these are really at local authority level. And in the case of Leicester, we're quite lucky in that it's a unitary authority, which is quite dull, but it means that, they are the highest authority. And you've got Leicester share around there as well. So you can see it quite clearly that there is a hotspot here. But even then, it's just a kind of slightly redder colour on a graph and doesn't have a lot of data. But, that's where Directors of Public Health really, will be getting this data. But they've only just got it very recently.
All right, Duncan, thanks ever so much. Look, maybe I know we speak on a Monday, but it might be that we need to speak in the next day or so.
Yes,
see if we can get a bit, because a lot of businesses will be in the wind about this, won't they? Worrying about whether they should have unfurloughed staff, whether they should do it anyway. It's a very worrying time. Duncan, thanks ever so much.
I think just wait for the announcements to come out. Lots of these things are brief, but just wait to see what is actually said.
All right, Duncan, thanks. And we'll bring that to you as soon as we get it, of course. Dr. Duncan Robertson from Loughborough University, our kind of science guide to what's been going on with the coronavirus.